I want to ask any of you who carries a smartphone. Everybody has a smartphone. So I opened my phone today just to demonstrate something today, and I have 115 apps on my phone. How many of you know how many apps are tracking your every second location and transmitting information about your purchases, about your likes and dislikes, and which clouds they go to, and how they track your Marriott locations and grade your status in a blink of an eye? I'm just saying this to demonstrate the power of technology, and none of us understand how this happens. Anybody knows how this can happen? I don't. I don't even know sometimes how to unlock my phone. Now imagine you're diagnosed with one of the rarest lymphomas known to man. And this is not a phone issue. This is your life and death issue. And you go out there and there's not much known about this disease. As a matter of fact, you guys probably see this commercial when the doctor says I was just reinstated, but don't worry, it's going to be okay. So when the patients come to a community oncologist and say, an established care, and community oncologist says, well, gee, this is pathology report. It says angioimmunoblastic T-cell lymphoma. Well, gee, I've never seen this before. This is true statement. This is true life when patients see physicians, because this is so rare. And oncologists in the community might have never seen hepatosplenic T-cell lymphoma. How much reassurance it gives the patient. Imagine you're diagnosed with fatal cancer. You come to a specialist, they've never seen it. The wake-up moment for me and Tony Ann Lupinacci, my nurse at the time, who was a co-founder of Foundation, was 7-8 years ago when I saw a patient in consultation with T-cell lymphoma who came to me after receiving 8 cycles of 5-drug regimen. And I started talking to him, and I always give very detailed explanation of disease and mechanism, and I'll come back to this point in a moment. And at the end of our discussion, patient was very, very grateful and said, finally I understand my disease. And it struck me, I could not even respond to this, because this person just went through ICU hospitalization, 8 cycles of chemotherapy, had no idea what are they treating and why they're treating, what the options are. So this was very, very sobering, and at that moment we started thinking and discussing how we can help patients in the era of technology where discovery is happening every month. Imagine that you guys probably can estimate how many new drugs discovered every year, targeted drugs, biologic drugs, immunomodulatory drugs. It gives the physician a whiplash. I just had to retake my oncology boards, and I had to go back to school for several months. Imagine patients. I always picture this almost a patient staying on a platform and a speed train just going away, and catching up with that knowledge is absolutely impossible. Now the other side of that, I call it dark side of that, what does it do to you if you don't know this? It's the definition of patients are disempowered, and they are really have their decision of the power of making decision taken away from them about their life, because you cannot make decision if you don't have knowledge. So we started thinking about how to bring power of decision and dignity back to the patients. And that's how T-cell leukemia lymphoma Foundation was born. And over the past 7 years, looking back, I'm extremely proud of our staff and everybody who made this happen. We are past 49 forums all over the country that were attended by more than 400 patients. And we reach out to patients in all the corners of the country. Just give you an example, something humbling that we are able to achieve. We received a phone call a couple of years ago from Iceland, from a patient with T-cell lymphoma that had nowhere to go for information and treatment. And in Iceland, they did not have any approved agents for T-cell lymphomas. So 3 weeks later, we were able to connect this patient with the agency in Europe that reached out to the company United States that shipped the drug to agency in Europe, and 3 weeks later, the patient in Iceland received the medicine under some protocols, compassionate use that was not even available. So this was very, very humbling, and all of a sudden we realized that we're doing something for patients beyond just the office and clinic and those 20 minutes that allocated to a person that facing life and death decisions. So the other interesting point about this, I was always wondering how we physicians carry this, and how do we walk away with decisions about somebody's life? How do you find power to make decisions where you know that you can be wrong? And the answer came to me in a kind of very simple way. The reason we walk and carry this, because we disempower patients from that decision. Because we take that away and we try to carry this and make decisions for somebody about their life. So giving back decision to the patient and partnering with the patient and about their choices, how to make them, really solves the problem to me as a physician, because we become partners, we become a family in that decision, and this can only come from education and giving patients power of knowledge about their disease. So I'm very grateful that we were able to achieve this. Like I said, we were always try to do this in a very non-high stage way. I'm very surprised and humbled by this award, but truly tonight is about patients, and our entire activity and heart behind foundation was about helping patients. Thank you.
Please join me in congratulating Dr. Shustov for his excellent focus on helping cancer patients. So again, congratulations.
Absolutely.
I'd like to thank everybody for joining us this evening, as we do have this common cause called Making Progress for Patients and Living with Cancer. And so again, thank you for all those involved in helping to improve that care. And I wish you the best of ASH and continued progress for managing cancer patients. So, thank you.